Start ke doktor?
Ustaz. Anis.
Okay. Saya present.
Yes.
Okay. Assalamualaikum. My name is Anis. I'm going to present today's case. So the chief complaint, Nur Quratu Amia, a 6-year-old Malay girl from Balok with underlying bronchial asthma, was admitted to pediatric ICU due to fever and chesty cough for 3 days and rapid breathing and noisy breathing for 1 day duration. That's the chief complaint. For the HOPI, she was relatively well until 3 days prior to the admission, when her aunt noticed that she had developed low-grade fever. There was no documented temperature at home. However, her aunt claimed that it was warm to touch. The fever was not associated with chill or rigor, feet, rashes, or diarrhea. The fever was temporarily relieved by suppository antipyretics. The fever was associated with cough, runny nose, and sore throat. The cough was chesty in nature and there was no whooping or barking character. It was associated with post-tussive vomiting with minimal amount of thick greenish sputum, but there was no blood or bile contained. Due to these symptoms, her aunt noticed that she developed poor appetite, tolerated only few spoonfuls of rice, and she was less active than usual as she preferred to sleep all day. Her aunt brought her to Polyclinic Arazi on the second day of illness. The documented temperature was 37.8 degrees Celsius, and she was prescribed with a suppository antipyretic since she had difficulty of ingesting oral medications. She was compliant with the medication. However, the fever did not really subside. On the third day of illness, she started to develop rapid breathing while resting. It was not persistent and was exacerbated by inhalation of cigarette smoke and cough. Her aunt noticed that the patient had noisy breathing on expiration, chest indrawing, and cold peripheries. However, there was no nasal flaring or bluish discoloration on lips. She was then brought to private clinic by her aunt. At the clinic, her temperature was 38 degrees Celsius and she was nebulized 2 times. However, the symptoms did not resolve and was referred to HTAA. At casualty, she was nebulized and was given intravenous medication and was admitted to in ward 6C for a few hours. And she was transferred to pediatric ICU due to deteriorating symptoms and SpO2.
Semula. Present semula. Dia punya HOPI until admission saja.
Okay.
Dia masuk general ward dahulu kan?
Dia masuk general ward.
Yes. Dia punya presentation HOPR is only until admission. The rest is a progress in the ward. It's not HOPI anymore. Why it's not HOPI? Because it's they already intervention in the management. They already start management. Okay. So it is HOPI until admission. Finish until there. What happened next is different. Is what happened progress in the ward. That's one different issue. Bisa semula.
So the history of apa doktor?
Present semula.
Present semula. Okay, dari awal. Okay, the HOPI. She was relatively well until 3 days prior to admission, when her aunt noticed that she developed low-grade fever that is warm to touch. But the fever did not associate with chill or rigor, no feet, no rash, and no diarrhea. The fever was temporarily relieved by suppository antipyretic. Fever associated with cough, runny nose, and sore throat. The cough is productive, but there was no whooping or barking character. It was also associated with post-tussive vomiting. that contained a minimal amount of thick greenish sputum, but there was no blood or bile contained. She also developed poor appetite, and she was less active in the day and preferred to sleep all day. Her aunt brought her to clinic second day of illness, and her temperature was 37.8 degrees Celsius. And then she was prescribed with suppository antipyretic, and then she was compliant with her drugs, but the fever did not resolve. On the third day, she started to develop rapid breathing while resting. It was not persistent and exacerbated by inhalation of cigarette smoke and cough. Her aunt noticed that the breathing had a noisy sound on expiration, chest indrawing, and also cold peripheries. But there was no nasal flaring or bluish discoloration of lips. And then she was brought to the private clinic, and at the clinic her temperature is now at 38 degrees Celsius. And then she was nebulized twice, but her symptoms did not resolve. So she was referred to HTAA, and then she was nebulized again at HTAA, and also given intravenous medication. And then she was admitted to general ward.
Anybody else want to ask about the? Is there anything else you want to tell us about HOPI?
Yes. This is the patient's second admission or first admission?
Sorry?
This is the first.
Safika, not for you, Atas. Safika, Faiz. Safika, anything else you want to tell us about HOPI?
Oh. She she had similar episode or symptom before, which is during 2 years old. So then she was actually already diagnosed with bronchial asthma at 2 years old, but she did not get any prescription for MDI before. So she was not on any medication. But then the symptoms came back, the asthmatic symptom.
So finish your HOPI already?
Up until she was admitted to the general ward, yes.
Have you finished your HOPI?
No, not yet.
Anything else you want to tell us about the HOPI?
There was a trigger to her symptom, which was cigarette smoke. Because she was spending a lot of time with her grandfather and uncles, who were smoking, and also she had an infection, so the upper respiratory tract infection. So I think the URTI also triggered her symptoms, the rapid breathing. And she also get triggered by cold weather.
Dah, habis. Nakrib, any question?
Does the patient also affected by any other allergen like the fur of the cat or the carpets?
No. No, she doesn't own any pet.
Afina,
After she was diagnosed with asthma, was she on regular follow-up?
No, she was not. So she was also not on any medication.
Guru Aiza,
I wanted to ask regarding the fever, cough, and runny nose. Did she have any relatives or siblings with similar symptoms of URTI?
Of URTI, no, but actually she has family history of allergic rhinitis, which her her father, mother, brother, and aunt has allergic rhinitis. So, and actually, her father has a history of bronchial asthma also.
Shamina,
Okay. I want to ask, either this patient able to drink or not, because the patient have any painful throat or something like that.
She had a sore throat and she developed poor appetite. Yeah, but I don't think she had any painful throat, but just a sore throat because of the cough.
any Sazwani?
Was the asthma induced by exercise?
It was not mentioned. It was not mentioned, but it was definitely triggered by smoke.
Anis,
I just want to ask about the noisy breathing. Is it during the inspiration or expiration? And do you know any details about the breathing, whether it's wheezing or stridor or anything like that?
It's a wheezing and it's on expiration.
Faiz,
During this past 4 weeks, does she have any asthmatic attack? 2 times, for more than 2 times?
I'm not sure, but it's not mentioned
Or
in
maybe
here.
she wake up, any episode where this 4 weeks she wake up due to asthma?
No, it was not mentioned, but stated here that she preferred to sleep all day. So maybe the symptoms might be worse at night, that that made her sleep disturbed maybe.
Okay.
Ara,
Was there any chills or rigor?
No, there was no chills or rigor associated.
any other question you want to ask?
I just would like to confirm, did the rapid breathing occur at rest or?
During her first presentation, yes, it happened at rest.
Any other question?
Is the patient has any known allergy to food or medication?
No, the patient does not have any allergy to food or any drug.
Any other questions? So Nakwit, how severe is it how bad is it the shortness of breath?
In my opinion, I think the severity of the shortness of breath is severe because the shortness of breath occurs while the patient at rest, and then there also presence of chest in drawing, but it does not mention any the severity of the skin retraction.
Anything else? Anis, berapa tahun budak ni? Remind balik the kid. How old child?
6 year old. 6 years old.
Many things you can decide from 6 years old ni. Unlike 1 year old, there are many things we can reduce. To know is severe, mild, moderate, or severe.
Can we diagnose based on the speech, the talks?
Jom nak fikir dulu. Your time will come.
Betul saya tak dengar.
Tak dengar. This child is 6 years old. There are many ways we can reduce severity from 6 years old, unlike 1 year old. Is there any other symptoms you want to ask? You want to look at to tell you is mild, moderate, or severe?
Maybe does the patient have shortness of breath while talking or while laughing?
It was not mentioned in the HOPI actually, but there was no complaint about exacerbation of rapid breathing during laughing or talking.
Afrina?
Was there any presence of wheezing?
Yes, there was presence of wheezing because the aunt heard a noisy sound during her breath, during expiration.
That's all. To tell you severity.
Perhaps about
Nurul,
I think I would like to ask during the presentation.
Go back all over again. This is 6 years old. You want to assess severity of this child.
Okay.
To decide is mild, moderate, and severe.
Okay. First, already mentioned, she is breathless at rest, and then I wanted to know, can she talks in sentences? phrases or words? Because and then the alert.
Anis, what the answer?
Yeah.
That actually there was no that nothing was mentioned about that actually, because most of the information was received by her aunt. So I think maybe you can assume that she can barely talk.
She can barely
talk.
Okay. And then what about her alertness? Is she agitated or just okay, active?
She was wait. She was irritable, but yeah.
Yeah, apa tu ya?
That's all.
Yeah.
Not much mention about her.
Anything else?
Yeah.
The respiratory rate.
The respiratory rate during the current examination, it was normal, but during the episode,
because the examination, you all by the time you all examine the child already. If you see, unlike we all during my time when I was a student, we stay in the ward such that the patient came, we are one of the first person who came to see. We did an announcement. That's why we can see all the findings. Unlike you all. But you all most of the time when your batch, your punya years that you only saw the patient when patient is stable. There's a difference between previous when we do the medicine and your time. Because we want to see the patient's signs, but that's why I don't like to go beyond history, because most of the time the sign not and this history not compatible, and you make a lot of mistake because of that. Because what you see for the history and the sign is not compatible. The history see to be recession, tapi when you all examine, it's already no recession, because you saw your patient one day after or 2 days been admitted, unlike us. Because we during our student day, we stay in the ward, we are creature of the ward, so we see all the fresh cases. That's why you many ask me, why didn't I go to sign examination? I say no point, nothing to teach there. And furthermore, it confuse you all, because the sign and the history not compatible. Confuse you all. That's why I just discuss history most of the time. So what is the other thing that you want to know? You all didn't grab yet. Yeah, you're looking at the from the parameter that you all read from protocol, breathless, taking orally, gender conditions, and then the wheezing, and then rate, all those things. The other thing, the chair can walk or not, the chair sitting only, the position of the sitting, all the other things, the chair can take a drink or not. So all the sign and symptom of severity. And the last thing, until now, I'm able to see saturation at ED is what?
Sorry, doctor, saturation
At E&E.
At investigation.
Saturation, SaO2.
Oh, it's 96%.
And then on oxygen. Tak tahu.
Tak.
Tak tahu.
Not stated in the.
Not stated.
No.
But the chest sinus or not?
No sinuses.
That's the thing. There are a few things. I mean, whatever in the ED, they did in the ED, as long as it's not admitted yet, it's still the HO.
Yeah.
Understand? Because the child has not been admitted yet. Once it's been admitted, you're not considered HOPI anymore. Because you already in ED is they do the acute management. So, Shabina, your conclusion, how severe is that?
I think it is severe breathlessness.
Pardon?
Severe shortness of breath.
Severe respiratory distress. Your evidence?
First, because the breathlessness occurs at rest, and then she appears agitated, and the respiratory rate also increase.
Apa? Itu saja. Aduh, lemahnya lah mengajar. Ustaz Wani? Why is it severe?
I think also the same with Shamina, because the patient appears breathlessness at rest, and also the alertness, the patient appears irritated. There's also accessory muscle used, but it is not mentioned the severity of.
Lagi, anything else?
No. I don't think so.
3 tu je. Ain. What's the background of the case?
Sorry, Doctor, what?
What's the background of the case?
Background of the case.
This is asthma. We want to know the background.
The essence of the case, do you mean?
Background. In asthma, there are 2 things you must remember. One is acute exacerbation. Second thing is the background.
I think it's because of the
You
bronchopneumonia.
got 3 things, you know.
Well
controlled, partial control, or uncontrolled. Poorly controlled.
Yes. Incomplete. I think it's. Sorry, Doctor. I have a distraction. No, my nurse. They was coming here. Okay.
Anak you?
Tak, Doctor, anak saudara. I think it's poorly controlled because it continues to the exacerbations and cause the clinical manifestation that was manifested by the.
How you assess the background or asthma?
I think it's because of the wait, I have the wait. Okay. Based on the PITS protocol mentions that we diagnose the asthma based on the this is probability. The number of exacerbations, the atopy or family history.
Faiz.
Based on GNAC.
Okay, based Gina, okay.
However, there's lack of it
This
based on
good control, partial control, or poorly control.
there's lack of information because one of the GINA
ada?
parameters, the need of reliever. However, this patient does not prescribe weight reliever.
So, lagi?
The things asthma symptom during daytime.
Ada tak budak ni masa dia sihat? Masa dia well, dia ada symptom tak during daytime?
For the past 4 weeks. I already asked, but based on the HOPI given,
apa answer dia?
There's no stated.
Lagi?
The thing is nocturnal symptom, such as waking up due to asthma.
Lagi?
Reliever for symptom.
Yelah, reliever you mention. Anything else?
Ada activity for the past 4 weeks. Any activity limitation?
Ada tak?
Can you repeat, Faiz? Yeah, the last one.
The last one, activity limitation.
Class induced lah.
No, there is not mentioned about that.
Not mentioned about that. Well, you choose not a good case. So cannot decide. Except that we got one exacerbation. One exacerbation considered as partial control already. Kan? Yeah?
Yes.
Quick. What's the trigger factor for this child?
The trigger factor
for this child.
Cigarette smoke. Cigarette smoke.
This child is admitted because of cigarette smoke exposure.
So you asked about the triggers. So the triggers for the child to have the symptom is cigarette smoke.
Yalah, this cigarette smoke, I mean that the child is admitted because cigarette smoke exposure. You faham tak? So the child is admitted because as a trigger was cigarette smoke. Syafiqah?
Yes. Yes.
Dia kena cigarette smoke, dia ada susah nafas. For this child.
Yes.
Then why they got fever?
Respiratory infection. Respiratory infection. One of the trigger.
If this trigger by cigarette smoke, would the child got fever?
No. The trigger was cigarette smoke and also URTI.
I asking for this admission. For this admission, what's the trigger factor?
Due to URTI, pneumonia, I think.
One satu ni, URTI ke pneumonia? Pneumonia is lower respiratory infection. Which one? Syafiqah, which one?
I think pneumonia. I think pneumonia, but the fever is only low grade and not high grade.
The high grade, kalau low grade kenapa pneumonia? Pneumonia usually high grade. Mana high grade? Pneumonia tu upper respiratory tract ke lower respiratory tract for high grade fever?
High grade fever, pneumonia.
So this is low grade fever.
So upper respiratory tract infection.
Eh?
Upper respiratory tract infection.
So it's not a cigarette smoke.
Exacerbated by the cigarette smoke.
You mean both?
Yeah.
For 4 months, be exposed to cigarette smoke. 4 months, Now only she having 4 months having cigarette smoke. Exposed with cigarette smoke 4 months. Now only she do the asthma, it become acute exacerbation.
Yes.
You understand or not? 4 months he's having acute 4 months he having exposed to cigarette smoke. 4 months, but no problem until these last 2 weeks before admission. He developed fever, then developed acute exacerbation. You faham tak the thought process tu, argument tu?
Faham.
Why is it 4 months he having 3.5 months to be exposed to cigarette smoke, no symptom. The last 2 weeks tu suddenly become symptomatic. Kenapa tak symptom 1 month ago, 2 months ago? If you say that cigarette smoke is the trigger.
Maybe because she was exposed to the smoke only recently.
Oh, you mean that he met the father only once a while, every 4 months, every 5 months?
Not father, grandfather.
Grandfather. So he stay with grandfather. He visit grandfather.
Yeah, stated that lately she's been during the symptom, she was seeing his grandfather and uncles a lot because she was being taken care of by her aunt because her mother was pregnant. So
Father?
her aunt who father not mentioned except that her father has had bronchial asthma also.
Father is not smoker.
No.
Father not smoker.
No.
Afrina, what is the essence of the case?
6-year-old girl, previously diagnosed with bronchial asthma, present with rapid breathing and fever.
Roll. By key that one. By key,
6-year-old Malay girl presented with acute exacerbation of asthma. And
Rapu tu. Nak merapu tu.
tak berani nak sambung dah, Dut.
Apa nak sambung? Cuma baiki yang itu je. Shamima?
Okay. A 6-year-old girl presented with acute exacerbation of bronchial asthma triggered by URTI.
Sazwani?
6-year-old asthmatic girl present with rapid breathing and fever.
Dah start dah. Terus tak improve. Semakin teruk. Noaim?
6-year-old Malay girl present with fever and chesty cough followed by rapid breathing and noisy breathing.
6-year-old girl presented with rapid breathing and fever.
What the child having now? Dia punya wheezing kan? So what's having now?
Acute exacerbations.
It's having acute exacerbation. The background of this child is? Apa background dia?
Partly controlled.
Is a asthmatic child. This is 6-year-old asthmatic child who are having acute exacerbation. What the next thing come to your mind? What the next thing come to your mind? Syazwani, tak takut nak sebut. Apa? Mulut terbuka lah.
Why? Why does the patient having acute exacerbation?
Why the child is having acute exacerbation? That is investigator mind. Siapa yang dapat that question inside their mind, I mean that they're going become good clinician because they answer the patient problem. They ask the patient problem. They ask the patient problem why the child having exacerbation. So what the possible cause of acute exacerbation? Possible cause of acute exacerbation. Cepatlah buat possible cause.
Pollen. Pollen,
dust. Kenapa tu?
Pollen,
Kenapa tu? Pollen tu apa? Kenapa tu?
Environmental triggers.
Triggers such as?
URTI.
You baca lah all the triggers, possible triggers. Any other causes of acute exacerbation?
Exercise. But not in this patient. Exercise, but not in this patient.
Triggers lah juga tu. Anything else other than triggers?
Allergen.
Triggers semua tu.
Like
all the possible triggers.
Compliance.
Lagi? Apa lagi?
Severity.
Severe, daripada mild jadi severe. Lagi? Apa lagi?
comorbidities,
Seperti
anxiety.
anxiety. Boleh lah, tapi adult usually anxiety, happy sangat. Apa lagi?
Air pollution.
Itu semua triggers dah. We're talking about triggers dah. Apalah, kita cakap benda selain bertriggers. Compliance, severity. Apa lagi? Wrong medication. The child supposed to take medication, was not started medication. Banyak possibility apa. Does her history answer all those questions? So does history answer satu, background of asthma, second, the severity of acute exacerbation, third, what is the cause of the acute exacerbation, and does her history exclude the other causes?
Yes, because well, the trigger is the URTI. For the compliant, she was not prescribed any medication, so we cannot tell. For severity, she she was admitted to the ICU.
That one severity of acute exacerbation. We're talking severity of the disease.
Severity, it's severe.
Because they got two cases. Severe was 6 months no medication. Why 6 months no medication is severe?
So it's just moderate.
Huh? What?
Or mild.
Mild apa?
It's just mild. That's why no medication was prescribed.
You mean mild?
The severity is only mild.
Why you say mild?
The asthmatic condition, because
you don't know the symptom at the first place. You don't know the daytime symptom. You don't know the nighttime symptom. You don't know even your history. You don't tell us is there any medication taken or not for the past 6 months. Immediately did she go to any clinic, take nebulizer ke apa ke? You don't know about that. And the history also didn't tell us the child can exercise like other children or not. The CBL didn't tell us that if the child affect the patient life schooling or not.
So it's hard to tell.
So do the history answer everything?
No.
I ask you one question. If you know all these things, when you listen to history, would the perspective you're thinking different or not?
Yes. Yes, different.
When you listen to the history, your perspective different or not? Will you not be more enjoy to listen to the history? Because you know what you want to look at.
Ask.
Why you cannot have all those things inside you?
Not much knowledge.
Where you can get the knowledge?
Reading.
Reading and your internet.
Google.
But if you're reading for the exam and reading for the patient, and difference or not? If you're reading for the exam, you get this. If you're reading for the exam, will you get this?
No.
If you're reading for your patient, will you get this?
Yes.
So medicine is easy or difficult?
Difficult.
If you get all this, you have in your mind all this, in your mind all this, the medicine become easy or difficult for you all?
Easier.
You get all this. Your thinking process are like this. You look, you listen, or this asthmatic patient who having acute exacerbation. In asthma, you have these 4 things already: background, severity of acute exacerbation, what the cause of the acute exacerbation in your mind already. Would you easy or not for you?
Easy.
So what's difficult about medicine? What's made the medicine difficult?
Too many things to know.
14 only about asthma. 14 only. And you apply for any other disease, chronic disease. If you're talking about nephrotic syndrome, this is a nephrotic child who having the relapse. You have to know about nephrotic syndrome. You have to know the child nephrotic syndrome, the complication of nephrotic syndrome, the complication of the medication, and then why the child having relapse. 14 only. 14 only. Difficult. In this case, the child is generalized edema. Come to your mind, what the cause of generalized edema? It can be from the heart failure. It can be from the nephrotic syndrome, nephritis AGN. It can be kwashiorkor. It can be a liver failure. It can be acute renal failure. So you look at the history. Is the history pointed to acute renal failure? Is the history pointed to nephrotic syndrome? Is the history pointed to the AGN? Why it become difficult? Is it difficult because you all make it difficult? Is it your mind make it difficult? You look at modern art. Lukisan is so, but some people they can understand it because it comes from the mind. If you organize your mind properly, would it become easy or difficult?
Easier.
Easier, not easy. Easier, not easy. You mean easier, not easy. Easier too doesn't mean it's easy. Less difficult, yeah.
Yeah.
No wonder you all suffer. Because you suffer because you think medical is difficult. If you think medical is easy, would you suffer or not? How old when the problem started? This child, when did diagnosed asthma?
2 years old.
How did diagnose asthma?
2 years old.
How did diagnose asthma?
2 years old.
Yelah, how did diagnose asthma?
Due to the first rapid breathing and wheezing episode.
Wheezing episode, shortness of breath, was admitted to the ward.
Yes, doctor. She was admitted
Admitted to
for
the
6
ward
days.
How many days?
6 days.
6 days. Before that, she already had recurrent wheezing or not? On and off nebulizer. Tak tahu.
That one is the first episode.
Then after that, they diagnosed bronchial asthma. Then the child discharged after 6 days. Any medication, any treatment given?
Nebulization,
After
but no drug.
No prophylaxis given. No reliever.
No.
So 2 years. So at age 3 years, no more admission. 2
No.
years, 4 years, 5 years, 6 years, any admission, any go to any clinic for nebulizer. Tak tahu.
Only during the previous few days during this
How you
episode,
know the
but
trigger is
during
URTI and the trigger is smoking? Because in that the 2 years ke 4 years, any nighttime symptom, any daytime symptom, the child can play or not. The child goes anywhere for nebulizer.
I don't know.
Don't know. At the 8 years, what happened? 3 days before admission, unwell.
Before admission was she was well.
Yalah, how many days start to be unwell?
3 days.
3 days. Started with fever first.
Yes, low grade fever.
Runny nose, coughing.
Yes.
Then treated by the GP.
So,
Not
yes.
plus nebulizer by the GP.
Yeah.
Then after that, on the day of admission, become tachypneic. Tachypneic. No cyanosis.
No cyanosis.
No cyanosis. Still can able to drink, able to talk.
Not mentioned in the study.
Subcostal nasal flare, subcostal intercostal recession.
There is subcostal resuscitation because there is chest indrawing, but no nasal flaring.
After that, he went to E&E.
Yeah.
Saturation 96%. Don't know on air or on oxygen, tak tahu. Then there was put IV drip, nebulizer, and given medication IV, then sent to the ward. So this is a second admission. Child eczema or not?
No eczema.
No eczema. Any cats at home?
Not mentioned. Yeah, she had pet cat and carpet at home, but it was not trigger.
Smoker. But the uncle, the cousin, grandfather is smoker.
Yes.
And then they stay with the uncle for the past few weeks because the mother is going to deliver.
Yeah, pregnant. She had.
Number what in your family?
Sorry, doctor.
The number berapa dalam family?
Dia last child.
Youngest. Of how many siblings?
Yeah. Three siblings. She's the youngest.
Anybody asthmatic?
The first child has allergic rhinitis.
The oldest brother.
All this.
Father got eczema, allergic rhinitis.
Father has bronchial asthma and allergic rhinitis.
Mother?
Mother, allergic rhinitis.
So where they stay? Near the factory, town?
They live in terrace house.
Terrace house.
Far from construction
Standard
sites.
what?
Sorry, Doctor?
Standard what? Standard 2.
Standard. 6 years old.
6 years old. So child is a
kindergarten.
Kindergarten. Any misplay kindergarten because of asthmatic attack? Tak tahu.
Tak tahu.
So apa difficultnya? Tell me what's difficult. What's the difficult? Apa yang susah? Ada susah? Apa? Apa susahnya? Anybody can tell me what's the difficult?
It's because we haven't practiced that flow yet. I think it's because we haven't practiced that flow yet. So
Dia macam orang tak boleh menari kan? Dia salahkan apa? Dia salahkan apa? Dia salahkan lantai. Ya, tak macam tu. You want to defend yourself. Tak. This is still not fair. Still reading. But is it too difficult to think like that?
No.
If your life is always organized things, you see, and people can, when they enter your room, people already know that you people who organize your mind or not. No, when people go to your room, go do at your room, from there, the people like us already know this fellow is the brain is organized, the brain is not organized. And complicated type or not complicated type. When we come to the room, we see everything, how he organized the room. Even when they choose the color of everything to make things inside their room, that tells us already your brain is organized or not organized. Where you put your handphone, where you put your watch, that tells us already. Organized or not organized. Because this is part parcel of you. But you have to practice lah. You want to be easy, you have to be part of you. You have to learn to organize things lah. So if you learn to organize things, your brain type of organize, everything is organized. And you feel very uncomfortable until you already organize the things. Okay, any question? Apa hilang eh? Apa hilang eh? Any questions? Senang kan? I teach pun senang. Senang, tak ada apa. Simple, settle. Any questions? Nak jawab pun mesti organize. You bukan hentam saja. You have to organize. When you answer, so everything have to be organized. Your weakness of you all is the thing is there most of the time, but you are able to look at it because your brain not organized. Okay, any question? Okay. Bila you datang balik, tak tahu. Tak tahu.
Tak tahu.
Dia belajarlah clucking, adik-adik you ke, parent you, mak you, siapa dia ada, mak yang ada hypertension, semua tu dia tinggi, cluck lah. Just you learn clucking, you belajar clucking. Get the history, everything semua. What to do, you cannot blame us. Kalau you tak pandai, salah kita orang, salah COVID. You cannot blame COVID, the problem is the COVID. Okay. Okay dah.